How long do swelling and bruising last after rhinoplasty? Have you ever wondered how long it takes for swelling and bruising to fade after rhinoplasty? The recovery process can be quite fascinating and varies from person to person. After rhinoplasty, swelling and bruising typically follow a staged timeline and can last from several weeks to up to a year for complete resolution. The duration largely depends on individual factors and the complexity of the surgery. Immediately after the procedure, swelling and bruising are most intense during the first 48 to 72 hours. During this time, the face, especially around the nose and under the eyes, may appear quite puffy and bruised. This is due to fluid buildup and tissue trauma from the surgery. The acute swelling phase usually peaks within the first week, and bruising is also most noticeable during this period. By the end of the first week, much of the initial swelling and bruising begins to subside. However, some puffiness, particularly at the nasal tip and around the septum, may still linger. A nasal splint is often in place during this time to protect the nose and support healing. Between the second and fourth weeks after surgery, swelling continues to decrease significantly. Many patients notice a marked reduction in bruising and facial discoloration during this subacute phase. However, it is common for some subtle swelling and mild asymmetry to still be present as the tissues adjust to the new nasal structure. By around 3 to 4 weeks, most visible swelling and bruising have resolved, and the nose starts to look more normal. While residual swelling may persist, it is usually not noticeable to others. Patients can often resume most normal activities by this time, but it is still advisable to avoid strenuous exercise and heavy lifting to prevent increased swelling. Late or chronic swelling can last from several months up to 12 months or more, particularly in the nasal tip and areas with thicker skin. This prolonged swelling is typically subtle and gradually resolves over time, revealing the final shape of the nose. In cases of more complex or revision rhinoplasty, complete resolution of swelling may take up to 18 months. To help manage swelling and bruising, patients are advised to keep their head elevated, apply cold compresses during the early post-operative period, and follow their surgeon's aftercare instructions carefully. In summary, significant swelling and bruising usually last about 1 to 3 weeks after rhinoplasty, with most visible signs greatly diminished by 1 month. However, subtle swelling can persist for many months, and the final results of the surgery are generally seen after about a year. Remember, it's always best to consult with your healthcare professional for personalized advice and guidance during your recovery.